Hi, my name is Krista Toby, and my topic is on depersonalization and derealization disorder. I'm going to talk about these disorders as two separate disorders just because it's a little easier to understand that way. So in this picture we have someone who is looking at the mirror and they're saying that it's never me in the mirror, not really. And from my research, I feel like this picture and this quote is the best way to sum up both depersonalization and derealization disorder. Some people have just depersonalization while some have just derealization, but it is very common for both of these disorders to be present at the same time. Depersonalization disorder is characterized as persistent and recurring feelings of disconnect from one's body, thoughts, or emotions. Derealization disorder is characterized as persistent and recurring feelings of disconnect from one's environment or from one's surroundings. Patients describe both of these disorders as feeling like you're constantly in a dream and you can't wake up, like everyone around you is right there, but you can't reach out and participate with them, and they can't reach out and participate with you. And since the first acknowledgement of these disorders by the DSM-2 in 1968, both of these terms have served as a general name for just feeling unreal. Depersonalization and derealization disorder is classified under the dissociative disorders like dissociative fugue, dissociative identity disorder, and dissociative amnesia. And similar to patients with other dissociative disorders, most people with depersonalization and derealization disorder have experienced some sort of trauma which induced the dissociative symptoms. This trauma can be anything from sexual or physical assault or some other violent crime, imprisonment, war trauma, vehicle accident, severe child abuse, just any trauma to where the patient felt that their life was in so much danger that they had no option but to disconnect themselves from what was happening to them, sort of like a defense mechanism. And during the trauma, it's described as an out-of-body experience, like your spirit has disconnected from its shell and is floating away. The symptoms of these disorders are kind of hard to understand as someone who has never experienced it. Feeling unreal or disconnected, knowing that you have feelings but not actually being able to feel them, feeling like you're far away from everybody else or everything else, even if you're right beside them, voices sounding far away or hearing your own voice in your head but it doesn't sound like your voice or your thoughts. And that's not to be confused with auditory hallucinations from other mental disorders. Feeling like a robot or a zombie, visual distortions like blurriness, tunnel vision, altered size and distance of objects. As I said, feeling like you're in a dream or like you're floating away, like your body's distorted. Sometimes people have trouble moving their body or being in control of their motor movements, feeling like events that just happened a long time ago, or having problems remembering things or owning the feelings while things were happening. It's believed that nearly half of all people who experienced a significantly traumatic event dissociated at the time of the event, but only in about 15% of that sample did the symptoms continue for a period greater than a month. And unfortunately for some people, these symptoms can last a lifetime. There's no actual cure for this disorder, and the effects of the symptoms can lead to depression, other mental health disorders, generalized anxiety, and even suicide. But fortunately, there is a wide range of psychotherapy and psychopharmaceutic options that can help with the symptoms. There are a number of antidepressants and anxiolytics that have helped to alleviate symptoms, as well as multiple multidisciplinary therapy techniques like grounding, meditation, acceptance and commitment therapy, mindfulness techniques. So if you or someone you know may have symptoms of depersonalization or derealization disorder, you should definitely contact a mental health professional to be assessed for a formal diagnosis to begin treatment and begin healing from this disorder. Also just to make sure that it might not be symptoms of some other dissociative disorder. Not much is known about depersonalization and derealization disorder, but we do know that psychotherapy significantly reduces the chance that these will become lifelong disorders. Thank you.